Assalamu alaikum. I am Alvina Haseeb, lecturer of Human Development and Family Studies from University of Agriculture, Faisalabad. Today, on this prestigious platform, I am here to represent my knowledge regarding the physical medicine and rehabilitation, which is known as PMR. Physical medicine and rehabilitation related in with each other in the context that rehabilitation is the process of helping a person to reach its fullest physical and psychological, social, vocational, avocational, and educational potentials in respective fields of education, physiological, anatomy, impairment, and environmental limitations also. In this rehabilitation, the desires of life plans are considered also. Rehabilitation is divided in following points: orthopedic, visual, mental, hearing, and speech. These types of rehabilitation are considered for the working of our community. According to WHO, rehabilitation is defined as a set of interventions designed to optimize functioning and reduce disability in individuals with health conditions in interaction with their environment. Simply, rehabilitation is to make the individuals in the working position so can they carry on their lifestyles to run with the other people in the mainstreams. Physical medicine rehabilitation, PMR, it is independent medical, which is concerned with the promotion of physical and cognitive functions, in which activities are participated in modifying the personal and environmental factors. Rehabilitation have four phases: medical rehabilitation, vocational rehabilitation, economical, and social rehabilitation. These are divided in two teams. In team one, we consider that physiatrists and physiotherapists work along with occupational therapists and social workers to rehabilitate the individuals in medical and vocational centers. Team 2 consists of speech therapists, psychologists, orthoptists, prosthetic, and vocational counselors. In Team 2, the therapists and psychologists, vocational counselors, they use to build up the courage to move in the society and to bring themselves to work out in the different aspects regarding the socio-economic statuses. WHO promoting health systems, strengthening for rehabilitation through many resources. They provide technical supports in building capacities in different countries. They increase leaderships. They politically prioritize the rehabilitation, and also they mobilize different resources for them. They develop norms and standards for the technical guidance which they can provide to the persons having impairments or disabilities to rehabilitate themselves. And they shape the research agenda and monitor the processes to evaluate the performances. There are few goals and aims of PMR, which is known as physical medicine and rehabilitation. First of all, PMR defines the processes to prevent the any problem, and then it diagnose if there is any problem due to non-rehabilitation processes. And after the diagnosis, there are processes which are in running system, and then they use to treat the individuals. PMR basically improves quality of life people suffering with disabilities, and they assess their potentials and needs to fulfill their needs and wants. They adopt the innovative approaches to bring them towards the mainstreaming and towards the normalized daily functioning of the respondents. They develop action plans to achieve the goals. They allow equity of access of employment for disabled people so that they can run with along with the normal people. They enable good state of physical, mental, and social health. They develop programs and resources to meet the needs of the respondents. Following principles of PMR team are to bring a learning process into running. Aims are rehabilitation team, PMR in different phases, and lack of rehabilitation and prevention. PMR specialists should know the principles of adaptation and plasticity of brain, that is brain learning. Adaptation is basically done in the rehabilitation process because the individuals have to adapt according to their existing needs so they can run according to their needs and wants in the daily life functioning. They improve quality of life. This is the basic law to improve the quality of life of the patient or as well as respondents. And they reduce the impairment and disabilities regarding themselves. Rehabilitation team member have almost 6-member team there is of rehabilitation, which work in combination with each other: physical therapist, family members, occupational therapist, physicians, rehabilitation engineers, and the most but not the least, assistive technology practitioners. They all work as a team member to rehabilitate the individuals in achieving their role in society, which is consistent for his or her life, or her life, to get good communication and regular team conferences to cooperate with the society and cooperate with their individuals. PMR work in different phases. Physical and rehabilitation medicine is also worked in acute and post-acute both phases. The appropriate environment is definitely required for the patients, because if we're not giving them the appropriate environment, then the patient will not be satisfied or gratified with the your PMR system. Maintenance and improvement of function, and they should prevent the complication, but the complication should be prevented by the following the all rules and regulations of the PMR systems, such as to keep in view their mental states, to keep in view their educational trainings and their diets. Effects of lack of rehabilitation definitely results in the worst effects. It means immobility of bed sores or contractures, muscle wasting, weakness or cardiorespiratory impairments also occur, difficulties due to bladder and bowel problems due to lack of movement, cognitive and behavioral problems occur due to isolation and social isolations. There are also psychological approaches during various phases of physical medicine and rehabilitation. Because when the rehabilitation process starts to occur, the psychological impact is on huge level. First, our respondents have to mentally and psychologically prepare that they have to rehabilitate and they have to face the world. With changes in modalities and exercises, psychological issues must be addressed. For example, immediate post-injury for an athlete. First of all, fear and denial wherein athlete may be experiencing pain or disability. He is in the fear that he may be removed from the panel, or he may be removed from the game. So he or she should be experiencing pain, and he is not ready to accept, and he is denying himself. Emotional first aid must be administered. Firstly, we have to stabilize his emotional levels. Complete diagnosis and explanation must be provided, so that the respondent should know itself that whether he or she is in need of rehabilitation or not, and whether which level of rehabilitation he or she is going through. Complete athlete must know to understand process and outcomes of that processes. Psychological approaches are further also moved towards the psychological and sociological consequences of injury. For example, that physical aspects of injury or social consequences, that the group support and the team member support and the family support and the peer group support, sports medicine team must should also understand that how to psychologically, emotionally they have to treat his or her own his team member. Each athlete should be respond in personal way and must ensure the physical and psychological healing before returning to the play. Role of personality and injuries must be taken into consideration. This is all about the physical medicine and rehabilitation. Thank you.